We have confirmed 216 new cases over the last 24 hours, bringing the total number of COVID-19 cases to 4,696. There are currently 87 people hospitalized due to COVID-19, with 20 of these individuals in intensive care. So far, 1,664 people in our province have recovered from COVID-19. I must also report that there have been 2 additional deaths in the province. This brings the total number of lives lost to 75. I do not want this number of deaths to become just one more statistic. The same is true of all those in ICU and hospital, where numbers of those needing hospital treatment has increased over the past few days. These cases illustrate that infection with this virus has serious consequences for many people. Families are grieving those who have died. Other families are worried about loved ones in intensive care or hospital, with visitor restrictions causing separation on top of this worry. These are the reasons we cannot give up on our work to prevent spread. This virus can only be defeated by our collective efforts to protect each other. We also need to protect those who are most vulnerable. There are currently 458 confirmed cases in Alberta continuing care facilities. Outbreaks in these facilities remain a major concern, which is why we expanded testing eligibility to include asymptomatic staff and residents in any facility with an outbreak. There were some initial difficulties in getting this up and running in some Calgary facilities, given the volume of outbreaks that are being experienced. But Alberta Health Services has worked hard to bring in additional teams to make testing available in these sites. It is also a concern that over the weekend, we have identified 4 cases of COVID-19 in Calgary's homeless population. Alberta has specifically prioritized testing in vulnerable populations, including the homeless population. Over 1,000 symptomatic individuals experiencing homelessness have been tested to date. All results had been negative up till yesterday morning when the first positive result was reported to Alberta Health. Alberta Health Services is investigating to determine if there were any further exposures and is following up to ensure steps are taken to limit the spread. This is a concern, as homeless Albertans don't have access to the same kinds of supports and resources that many of us have available and take for granted. As a part of outbreak management, we have implemented testing of all contacts, both symptomatic and asymptomatic persons, at the centres that are affected. This testing began yesterday. In addition, in both Edmonton and Calgary, a process is being put in place to offer testing to a sample of asymptomatic people experiencing homelessness. Alberta Health is discussing this testing process with shelters and physicians in those cities for individuals who consent to this testing. This step is a precaution to help us identify cases as quickly as possible and reduce the chance of outbreaks occurring in shelters and similar settings. More details on this testing will be shared in the coming days. Another situation I want to talk about is in the Edmonton zone, where there are 2 investigations underway of small hospital outbreaks where swift action has been taken to contain the spread. These are at the Sturgeon General Hospital and the Royal Alexandra Hospital, where a small number of cases seem to be linked within each facility. There are no links between the 2 facilities. Another case identified at the Edmonton General has been linked with the Sturgeon Hospital outbreak as a result of patient transfer. A quick response to these cases means that spread of the virus is being prevented and patients and staff are being protected. I think Albertans can take pride in the way that we have collectively managed to keep the virus under control. With respect to the spread of the virus outside of those outbreaks, I absolutely would say that, again, we've collectively been able to protect each other. The concern that I have when we look at those outbreaks is if we had an outbreak like we're seeing in some of these communities and we did not have some of our collective restrictions in place, the opportunity for the virus to spread very rapidly throughout the entire population and potentially undo some of this good collective work that we've done is still there. So I just want to be really clear that that Albertans have done an amazing job, and everyone should feel proud of what we've done together. And when we're looking forward, we need to look at how we're going to be able to ease restrictions. We absolutely must ease some of those restrictions, but do it in a way that we don't rebound and see that modeling come true just at a later point in time. So those would be the two messages I would want Albertans to know about. Firstly, be proud. Second, let's continue the good work and be cautious as we start to consider easing restrictions.